Good evening. My name is Dr. Ron Zokol, and we're here, compliments of Blatchford Solutions and Dr. Bill Blatchford, and thank you very much for the opportunity, Bill, to share what I do and to discuss aspects of the Pacific Implant Institute with the doctors on the call. For those who are not familiar with what I do, I am a general practitioner with about 35 years of experience in dentistry. I founded the Pacific Implant Institute approximately 15 years ago, and we've been teaching dentists how to build their practice into an oral implantology service. And the reason why many of these procedures are considered by the average general dentist is that in the attempt to create for yourself an incredibly successful practice, we try to generate and do procedures that are really much more valuable in terms of return for time invested. And so we concentrate on high-end cases, we concentrate on crown and bridge. Implants are probably that area of dentistry which yields the highest rate of return. And of course, it presumes you're doing it successfully. So in terms of launching this in a practice that is a general practice and principally for doctors that have not got a strong foundation in surgery, what we do at the Pacific Implant Institute is to establish a sound series of skills and diagnostic as well as clinical skills in surgery so that when a dentist does take training as to how to place an implant and such, that they do so with comfort and confidence and predictability. So many of the people who have taken courses before tend to hang up their equipment because they're finding themselves getting into a little bit of difficulty, and that's what we try to avoid. So the Pacific Implant Institute is founded, if you take a look at the slide above, it says strategically designed to train GPs for surgery and comprehensively designed to train leaders in oral implantology. And that is two purposes, really. One, so that we can build the surgical skills for general practitioners in surgery, and number two, depending on your desire, whether it be to do basic oral implantology and as a general dentist and selectively take cases on, or to develop skills that allow you to do full mouth reconstruction surgically and prosthetically. These are the skills that we do, and so we teach comprehensively, we teach with science as a background, and as such we have established a protocol by which dentists have very successfully taken their implantology CE program and gone directly into the field and established themselves very successfully. I'm proud to have Dr. Robert Miller join me last year, and he is now teaching our program in Boca Raton, Florida. And as you can appreciate, that comes with a little bit more beautiful climate than does Vancouver, Canada, although we're not too bad ourselves, but we get a little bit more sun. So for those people on the East Coast and the South area, Robert's program is very easy to get to and certainly not difficult to enjoy given that environment. The process by which we make implant dentistry successful requires more than just clinical skills, and while my institute is designed to establish clinical skills, it's important to understand that it's very, very important that you be able to sell the process, that you understand what you want to accomplish very quickly, and in the process of telling your patient and giving your patient some guidelines as to where they want to go, you're going to be involved in some expensive dentistry, and the successful ways to present to patients is a very important consideration. And it implies that you have sales skills, and in order to do that effectively, what we do is we ask our doctors that have gone through the program to take a look at Blatchford Solutions. Why? Because the doctors and teams that are not properly educated in terms of office synergy and teamwork and such have a difficult time selling large cases, and it's a very uncomfortable process. So we encourage people to get the training to do just that. And perhaps, Bill, if you're on the line here, would you come on in and share some thoughts as to how Blatchford Solutions can help the doctors develop the skills to encourage their patients to successful treatment?
Well, Ron, thank you. Pacific Implant Institute has been very successful in adding implantology to dental practices, and it's something I've recommended for years, is to branch out and diversify and learn some new skills. And especially when you look at the aging population of baby boomers, there's tremendous opportunity out there for the general dentist that knows how to place implants. Many dentists are restoring these implants, but as Ron knows, I've always gone under the premise that the last one to touch that tooth owns it. And if I'm going to own it, I want to be in control. And so we have had a lot of our clients go through Pacific Implant Institute and learn how to very successfully place implants. But here's one of the things that Ron has always encouraged me to do and invited me to come up to Vancouver to actually spend some time with participants to learn how to present the implants. To present a case that is multiple thousands of dollars, perhaps as much as a new car, it's going to require different skills than when a patient walks into your office with a broken tooth and it's obviously broken, and you or your team says you need a crown on it. Well, that's an obvious one, and it's not too difficult to have the patient accept that, especially given that as a single crown, most people have insurance, and the insurance will pay roughly 50% of that. Well, you're selling something that's on sale at 50% off. But as we move into these large implant cases, and we are looking at cases from, say, $4,000 or $5,000 to perhaps over $100,000. And so you move into those cases, and you have to really be able to present that in a way that the patient says, wow, it's a lot of money, but yeah, it's something I really want and something that I want to do, and I'll sacrifice other areas of my life to make that happen, because that's really what people have to do. You see, people can generally afford pretty much anything they want, even though they may have to go without something else. I mean, we're not talking third world countries here. We're talking the United States, Canada, Western Europe, and we're talking countries that people do have an income that with a fair amount of discretionary income. Now, I think one of the things we probably should define here is what is discretionary income. And one of my early financial advisors kept pointing out to me that anything beyond half a bowl of rice a day is an option. And his evidence was that half the world lives on half a bowl of rice a day. So if you're listening to this and saying, well, your patients don't have discretionary income, let's redefine that. Your patients have lots of discretionary income, and actually they choose to spend it on discretionary items like new cars, bigger houses, more furniture, big screen TVs, vacations, etc. And then, of course, they will tell you they cannot afford the large implant or restorative cases, when in fact what they're really telling you is the person that sold the new car, the bigger house, the new furniture, the big screen TV, the vacations, were much better at presenting value for their service than what you've done. And so we spent some time with that, how to do that. Dr. Zokol's been so kind to put some slides together for us today, and I think that item number 2 is how to look beyond traditional methods of educating patients, and that has been the traditional method in dentistry to present value. Is if I just teach them enough about it, if I can just show them, if they just understood what I know about this service, they would do it. Well, you know, I've been doing seminars now for 25 years and speaking to rooms of several hundred dentists at a time, and of course one of the things I like to do is take my remote control and I say, this is a beta test site for an infrared intraoral camera. As I walk down the aisle, I start to say that I can probably find at least one dentist or hygienist who has not had their own teeth cleaned and checked by another dentist within the last 6 months. I can probably find a dentist who has a missing tooth, or I can probably find a team member with a broken tooth. In other words, here we are with a highly educated audience, and yet we're not having the dentistry ourselves. So we have to look beyond that as ways to present this. And one of the things that we have found is that you have to appeal to the emotions.
Indeed, you know, this comes down to, Bill, is that we really have a two-pronged effort for success, and one is the clinical skills, the other is ability to sell it.
Exactly. And see, we have doctors that all over the country that have taken lots of implant courses and can't sell it. And then, of course, we have people like me who can sell it and don't have the skill to do it. So fortunately, I'm not trying to do that anymore. That is dangerous. But I recognize that, and I'm not doing that anymore. So, but the point is that Ron makes is that you can have all the skill in the world, but if you can't market it and you can't sell it, it doesn't make any difference. And I have been doing what I do for the last 25 years, and I see a lot of frustration out there with people with tremendous clinical skills, but they cannot sell it to their patients. So that's what we work on, and what we've learned is people make decisions emotionally. They do not make people. When I say they, I'm referring to myself as well. We do not make decisions based on data or facts. We make decisions based on emotions, and of course our brain has two sides. It has the right and the left side, and of course all of us dentists are left brain thinkers. We're very logical. We got good grades in physics and math and chemistry, and so we got to go to dental school, and we think that everybody thinks like that. But you know, I practice in a college town where the biggest school is a school of engineering, and you'd think these people are all very logical thinkers as well, but they're the same way once they're out of their field. So the right brain is the emotional side, it's the side we dream with. And if you think for just a moment how you make decisions on major things in your life, it's always emotional. And then what we do is we gather data to support that decision that we've already made. And the interesting thing is that the data always agrees with that decision that we've made. And so that is something that we work with a lot. And what we've done and what we teach, of course, and Ron is always kind enough to have me come teach at the Institute. Of course, I teach this all over the country, but the questions that are designed to develop and to uncover those emotions that the patient will make the right decision to actually have the best treatment available. And that's what, and Dr. Zokal's office, he has a lady named Kim who is phenomenal at this. She is absolutely incredible at doing this, and before Dr. Zokal even sees the patient, is that she sells these cases, and what she does, she doesn't talk about the technique or the technical side of it. What she does is she talks about what the patient wants, why they want it, how much of a problem it's been for them, and then she goes from there, and she even goes ahead and gives some estimates, and then they decide what they want to do. So Ron's time is very minimal, and that's really what we teach. Is he doesn't have the time, and neither do you, to spend an hour, hour and a half with these people prior to them making that decision. So
Bill, in most cases, the patient has made the decision to purchase the treatment, and all I do is come in and validate the appropriate treatment and add any little things that Kim isn't sophisticated enough to understand.
Exactly.
As the doctor. But apart from that, the patient in most cases, even with the very expensive treatment protocols, has decided to go ahead with it. All I have to do is come in and justify and validate what she said, or if I do it inappropriately, I can disrupt the process. So the best time for me to do is get out of there.
That's right.
So that's really the way I see it. You're just absolutely right. We've followed your programs and your training, and Kim developed her skills as a result of going through Blatchford Solutions. And because we're all on the same track, it's made it quite simple. She happens to be very charismatic and got a very nice voice, so she's come along beautifully well.
Well, she has, and this is the thing that I point out, is that we can really train any team member that has a great attitude and is willing to learn, can learn this skill. And with this kind of a skill, this team member can sit down with a potential patient and ask the questions and find out what the patient wants, and without any technical knowledge at all. Now, I don't want to take away from Kim, because she has quite a bit of technical knowledge as well after these years, but without any technical knowledge or discussing technical things with the patient, she is able to basically sell the case, and it is closed really before you even see the patient, and that's the wonderful part of this. You get 5 to 10 minutes and find out, can we do the case, yes or no, and encourage the patient a little bit, and then at that point Kim works out the financial arrangements, and then the next time you see that patient is for a complete examination and treatment planning. So it's a great combination. Ron, why don't you show us some of the cases that that you can do with implants? I mean, I think a lot of doctors are they think of replacing a 3-unit bridge perhaps, but if there's enough bone, I think some of the cases you do are really interesting.
Sure. Thank you very much. Let's go ahead and see if we can do something here. Let me show you a case that actually turned out pretty well. This lady right here was missing a central incisor for many, many, many years, and it just turns out that she happened to be a hygienist and her father a dentist, and she had a removable partial denture for a couple of decades before she got enough courage to trust it. But what she didn't want to do was cut down those beautiful natural teeth. She realized the value of it, and when we went ahead and we put an implant in for her, this was the end result that we got. And I would have you look at the quality of that ceramic work, which is really the laboratory's doing. That's a beautiful, beautiful laboratory result. I hope you all can see it. The soft tissue response, and that's what we're capable of doing in oral implantology. And much of the success is understanding the biology and the science behind how the tissues are going to respond. So part of the decisions you make in terms of form and character and such have a foundation understanding the tissues, and that's one of the things that we like to teach, so that you are capable of achieving the optimal results as frequently as possible. Sometimes it's beyond our control as dentists to generate this type of quality on a regular basis, and I wish I could say that I could get it 100% as well, but it's not necessarily the case. This lady here, very fortunate the result turned well because she's got a very high lip line. She shows a lot of gum tissue. Anyway, so that's a case that turned out rather well. And this is about if you can see, this is a 4-year post-op. And given her hygiene skills as well as the character and quality of the refinement and prosthetics, that the tissue has responded beautifully, and when we can get results like this in oral implantology, it really allows us to stand out as far as our patients are concerned, and our colleagues certainly appreciate it as well. There's a lot of reasons.
You see a case like that. Sorry,
Bill, go ahead.
If I can just butt in here for just a moment, you see a case like that particular lady, I mean, she knows what she wants. She doesn't know that she wants an implant, but she knows she wants to look have a beautiful smile again. She does not want something that's removable. She wants something that's fastened in. And we also know that she's tried removable appliances in the past. They have not worked, and she knows all of that. And so really, you see, that's an easy case to present.
You know, that's correct, and you're so right. This is one of these cases, you know, as a treatment provider here, both surgically and prosthetically, this was a no-win for me. I mean, these people here don't go around and tell everybody, look at the implant tooth I got, because they would like to appear totally natural and give the impression as though they've never had any type of a problem at all in the first place.
Right.
So it's gratifying when you can achieve results at this level. But you're quite right. The patient's emotional response here is, wow. And do I get referrals from this lady? All the time. Particularly when she looks in the mirror and takes a look at that tooth, knowing full where she was, 10 years ago.
Yes, beautiful case.
Thank you. There are some fundamental principles in single tooth failure, and this is why for the general practitioner it is so valuable to treat this failing single tooth, because everybody sees it, and it's not something that's necessary to send out to specialists, especially if you've got these fundamental skills, and they're not that difficult. This is what we like to see every general practitioner be able to provide very effectively. One is atraumatic extraction, then be able to resolve the disease, compress the healing response with the understanding of tissue biology and how to manipulate that so we get good healing efficiently and effectively, and then go to treatment options, which could be immediate implant placement with provisional prosthesis or ridge preservation and a delayed implant placement. I think these are just so fundamental And they're so easy to do if you understand just the basic principles that that I think it should be in the hands of just about every general practitioner. And by the way, and I don't think I've mentioned this, but I am a general practitioner. I've had a good, really solid foundation in prosthetics. My father was a prosthodontist, and I had the luxury of spending 20 years in practice with him. But I also was a surgical instructor for the Implant Institute, actually, for the better part of 12 years. And so I've got both a very strong foundation in prosthetics as well as surgery. So I'm able to do this, and I'm able to teach it. The beauty is what I know is what it takes as a general practitioner to become successful in this field. Now, many of you might feel that all you want to do is do the stuff that's limited within your practice, and I think that's great. So what we do is we help people understand and be able to achieve the clinical basis for simple stuff like this and be case selective. But for those who want to go past, we can fulfill those requirements as well. But here we take a tooth out atraumatically. And I remember a time when I would refer this case because I didn't have the surgical skills. This is not a difficult process to get this out within minutes atraumatically and preserving the bone structure. The ridge preservation graft, we have a protocol. I developed a protocol about 14 years ago, which allows me about a 98% level of success in retaining the volume of the ridge that I need to put an implant in and attain a very, very high surgical, aesthetic and functional result without further bone grafting or advanced procedures. And it's not that difficult. We have, once we do that extraction and we apply that ridge preservation protocol and take that membrane out of there after 2 weeks, we see this type of environment. And what happens is the gingival tissue granulates beautifully. The keratinized tissue granulates over top of that, and you end up with a beautiful ridge that becomes very, very simple to put an implant in. And I swear that and my belief is that when you have a bone and a ridge like this, it is easier to put an implant into that area than it is to do a class 1 filling on a molar. It's just that easy, and I know that each and every general practitioner, regardless of your background, if you just learn the fundamentals of this stuff, can do this so easy. And the beauty is it's a great service for your patient, but it also helps your practice like crazy. And people...
Well, I've seen this. I've seen this in practices where doctors come in with no implant training or skill, come into this in the institute and go out being able to do these cases very easily and routinely in a practice.
And really, that's the key. And as I say, it should be fundamental. What we have here is a little biopsy punch into that tissue as to where you want it to emerge from the gingival tissue. Go in and put a burr into there. It's easier than taking a small burr onto a occlusal of a tooth and just deliver the implant right through the tissue into the bone and put a healing collar on, no sutures. For the experienced person, this is probably a 10-minute procedure. For somebody who takes a little bit longer, it might be 25, 30 minutes. But it is basically a very, very simple process. And the results are first class. And it gives you the opportunity to then, once the tissues have healed and the implant is ready for a tooth, to put a tooth on it. Now, this isn't a particularly aesthetic result here, and we went ahead and later on replaced that for this patient. But you can see the level of service it can provide where the tissue response is excellent. And we didn't do anything special. If we took it out wrong and didn't put a graft in there, that tissue would have collapsed and we'd have had a bone graft and a soft tissue graft and many, many months of therapy with greatly higher expense with a poor result. But if we treat it correctly at the time that we took the tooth out, we can avoid all of that, provide a service where the patient looks at it and says, man, that's pretty good, and they'll refer other people to you, and you've made a very, very high return on the time that you spent. And by the way, time invested in oral implantology can yield you, for the time in some of the more comprehensive procedures or implant placements or some of the grafting procedures, an hourly return of anywhere from $2,000 to $6,000 per hour. In my practice, I would estimate that if you averaged all my time, including just basic examinations, I generate somewhere in the area of $2,000 to $2,500 an hour. And that's averaged over time when I'm not billing much. But it's because there's a high concentration of return doing these implant procedures that give not only the patient huge value as a result, but also your practice and the quality of life that you have as well. So this is the patient here. As I say, I don't like the color of that, and we replaced it after a bit. But that's the easy case, and I want to show you some of the things that if you have the training and understand the tissue, you can do all kinds of interesting things in oral implantology. And I must say this is very, very leading edge. So I'm going to show you stuff here I don't expect anybody but the very advanced people to do. And I'm showing it not so that I expect you to do it, but to show you what we're capable of if you understand. And if we can teach you this, you'll eventually be capable as well. You have an upper right cuspid here, which is an early implant failure with a massive amount of bone loss. The patient is an attractive young lady, and she has a Maryland bridge because both the oral surgeon, the periodontist, and prosthodontist that were involved in this case earlier didn't know what to do with her after the failure of the implant case. So what we did is that we took the Maryland bridge off. This patient was referred to me by the prosthodontist and says, we don't know what to do. And he saw a lecture that I gave on bone grafting and says, is there something you can do here? Well, we took a look at this case. This radiograph here shows a very large bony defect. And when you took the prosthesis off, you can see the palatal defect, the facial defect, there's a vertical defect. What you can't see is the denuded root on the lateral incisor until you remove the tissue back, and you can see that now. And you can see the nature of that defect. And there's no way you get an implant in there until you rebuild the foundation. And the question is, can you do it predictably? Well, some people can, others, even those who have been doing implantology a long time, or not devoted to the science of the field, will struggle severely with this type of a solution. We cleaned up the root, took care of the bone structure there, and got it ready to put a graft in. This is a titanium mesh. If you can see the slide, I hope this is coming through clear. And that is there to build the volume in the manner that we want. Bone grafting material goes in, we make sure there's a blood supply. We support the graft with a tie mesh, which gives it structure and immobility so that the body will respond correctly and it will turn this area into bone. So we push the bone material, the tie mesh goes in place and secured in place, and we close the soft tissue over top of that. And you can see the form that's being generated with this particular slide here. Put a membrane over to inhibit the soft tissue ingrowth through the membrane and into the bone area so that we can optimize the full volume of bone there. Soft tissue control is the other thing that we teach because we've got to keep the bacteria and control the inflammatory response and manage the soft tissue for a primary passive closure and bring the tissues together and allow them to heal. Post-op radiograph, which shows the result of the surgery itself. And this is 2-week post-op. And the patient has done her part. We really work on how to manage the patient preoperatively, postoperatively, so that you get results that are optimal. Because no matter how good you are in surgery, if the patient doesn't provide some support for what you're doing, they can undo just about everything you've done well. As time goes on, we uncover this after 5 months. We open that tissue, take this bone screws out, and here's the bone volume that we are able to generate. Now, once you've got that kind of foundation, you can pretty much do anything you want. What we have to do at this point is improve the character and quality of the gingival tissue. So periodontal surgery, improving keratinized tissue in the area, becomes a fundamental process as well. If you're wanting to achieve the best aesthetic and long-term functional results for your implant-supported teeth, these are protocols which are very, very valuable. So we closed her up and let her heal, and you can see how that bridge has built up there. The implant is in. And as we move forward, here is a temporary crown on there. And this lady, she will be going to final restoration when those tissues have matured properly. And we'll be referring her back to the prosthodontist when the tissues have responded completely. And she will retain a level of aesthetics after this that she would be very, very hard-pressed to have had without this advanced type of implant and grafting protocols. Vertical bone grafting is some of the most difficult stuff to do in implant dentistry, yet with the proper foundation, science, and surgical technique, we can achieve incredible things that we couldn't before. 2 implants placed in a edentulous mandible area, placed proud. In one case, about 4 or 5 millimeters above the bone. In another case, 6 to 8 millimeters above the bone. And again, with the proper management in technique and understanding the proper criteria to do this type of bone grafting, we can do incredible things with this. And this is a process by which we built up these areas here for the patient. Again, with tie mesh, putting that into position, blocking it down, letting it heal with all the same protocols as the previous case that you saw, inhibiting soft tissue ingrowth, closing up with primary passive closure, getting the patient to care for this area properly so they don't expose the membrane. Come back 5 months later, open it up, and what do you have? You take the tie mesh out and take a look at the bone. This is the stuff that blows most surgeons away because they just don't understand that it's even possible. But this is what you get when you manage the sciences correctly, and you're able to rehabilitate cases that the great majority of clinicians literally don't even know is possible. And when you can treat these cases this way, there is huge, huge value for growth. People will refer to you, and the more you do oral implantology within your practice, either from your own patients or from patients that are referred by other dentists who are looking for results like this, your practice will grow, and the more oral implantology you do, so will your rewards on your bottom line.
Well, those are some interesting cases that you've shown us so far. I mean, these are, and what I see with these cases and what I see with the students that take part in PII is by the end of their first year, I won't say they're doing these real advanced cases, but they are certainly able to tackle just about anything that requires mandibular bone grafts, sinus lifts, and multiple implant cases. And these are very rewarding cases from an emotional point of view, but also from a financial point of view. And I've seen these added successfully to practices that have made a tremendous difference in the bottom line.
No, it's so true. And my goal in providing this information is that if I can teach doctors to do this type of surgery as a general practitioner, all the other stuff becomes a lot simpler. And doing 2 or 3 implants here, doing a little bone graft there, the meat and potatoes of general practice where you have a 1 or 2 teeth failing, those become the simple ones. Those become everyday, simple, easy, and the more you do of those, the higher rewards that you'll get financially and patient referrals as well.
See, one of the things that you and I have talked about, Ron, in the past, and you participated a few years ago in a seminar we did called the Purple Cow. How do you make a general practice stand out? I mean, what do you tell patients? What's your 30-second elevator speech? Is what I've always asked. And you can't just say that, well, we do excellent care in a warm, caring environment. That's what they told me down the street or across the hall. But if you can provide a unique service like oral implantology, it absolutely makes your practice stand out. And all of a sudden you have something that people will literally beat a path to your door, again, provided you can market it, and then of course you can sell it once they're there. So go ahead.
Yes, I think that one of the things that a general practitioner has to do if they're going to get involved at a high-end level is that they've got to refine their services to the equivalent level of other specialists in the field in periodontics or oral surgery and such, and which means they have to have a strong, solid foundation. So my recommendation is start simple and allow the growth to be gradual, taking what you know and grow with control, to use the science and the technologies that are out there to make yourself stand out. For example, some of the laser technology today is absolutely indispensable. in doing high-quality work in oral implantology. And when you have the equipment and you can show the results and show patients that you are leading edge in what you're doing, you'll end up getting a lot of referrals. And patients appreciate the value of technology and when you're leading edge. For example, what we show here is PRF, platelet-rich fibrin, along with platelet-rich plasma to enhance the healing process, which provides growth factors to enhance soft tissue as well as bone grafting protocols. And what we want to do is really make sure that the patients are treated optimally from a point of clinical skills. And by the way, most of these procedures are done without any pain. Post-operative pain is almost non-existent when you treat these people really, really well. I find that that's one of the biggest practice builders is when patients tell their friends and such, you know, I went to Dr. Zokol, I went and what they provided in terms of medications prior to the surgery and what they told me to do after the surgery allowed the healing to go really fast. I had no pain whatsoever. Many of our patients literally maintain a chest full of these Tylenol number 3, which we give prophylactically just in case they run into pain. And every now and then we'll get one of those, but it's very, very unusual to see a person to have any amount of pain following any of these procedures at all. So my goal would be to say, doctor, if you're interested in improving the bottom line of your practice, and if you're interested in enjoying the type of dentistry which is reconstructive, both from a possibly surgical or prosthetic area, you need two things. You need the skill sets to do it, and you find yourself a mentor, and you find yourself a facility that has the science, and particularly a mentor who has been there as a GP and has made a successful practice. Now, my practice, for example, is completely referral. I do not have patients that come in off the street. I have patients that are referred to me by many specialists and a lot of GPs as well. And to do that in an environment where there's a plethora of periodontists, oral surgeons, and prosthodontists, it suggests that perhaps I'm doing something that works. And I think I can help doctors get there themselves.
Well, you can, and I think you can teach. Yeah, you can teach this skill, and it is a learned skill, and you can teach this. I've seen it. And so for those doctors thinking about implants, this is an excellent way to pick up your knowledge and your skill and to grow your practice.
And when it comes down to it, Bill, the clinical skills are the easy thing to teach, I feel. And I've seen doctors go away from a session, go into their office and start utilizing it. And even though the training is expensive, on a cash flow basis, they're rarely in the negative here if they start selling it in dentistry. And the question becomes now, how effectively can you get your patients enrolled in that treatment? And this is why we come back to the Blatchford Solutions group.
I think that's important too to think. What's expensive? I think that's the thing. The training for the implants is expensive, and it depends what's expensive, and it's only expensive if you don't get a return on it. Something may cost a lot and actually be very inexpensive in the long run. But one of the things that I see is that if you learn to place the implants, if you learn to restore them, and then, of course, once you have that skill, then what you need to do is you and your team need to learn to sell them, and that is where I come in, and so I'm part of the Pacific Implant Institute. Well, Ron, that was very enlightening for the cases that we've done. Of course, I've watched over your shoulder, and you do some of these cases, and it's absolutely amazing what can be done, and I see cases where dentists are literally throwing their hands up and filling out a referral form and sending that out of the office, whereas this can be done right in your office very easily. So I want to thank you for your time here tonight, Ron, and I look forward to working with you, of course, in future Pacific Implant Institute sessions and helping those doctors gain the skills in the marketing and the sales of those services.
Well, it's a pleasure to work with you, Bill. I certainly truly believe that the success in this field requires your type of skills as well as the ones that I offer, and I do appreciate your support, and I appreciate the professional camaraderie.
Excellent. Now, we also have a fishing trip coming up this fall, or actually in August, that we might want to mention. You've put the deposit down, I know, and you've got a group at El Dorado Lodge. You've got a pretty good little program.
Yes, El Capitan Lodge.
El Capitan, excuse me. And we did it. We went to that lodge last summer. The year before, we came down to Mexico, and the year before that, we were up in British Columbia. And it's the business of implant dentistry, and it's a great little meeting. We combine it with a lot of fun as well. So if you're interested in that, go to the website, Pacific Implant Institute as well.
Yeah, that's correct, Bill. And I'd like to invite anybody listening to give us a call. If you like fishing and you'd like to learn more about the business of implant dentistry, this is a great combination. We took home a couple of 100 pounds of salmon and halibut after last year's catch. It was great. So when you add pleasure like that into things that improve the bottom line in your practice, that's pretty hard to beat.
That's right. All right. Thank you very much.
Thanks, Bill.